Hi guys, Dr. Jeremy Height with Pinnacle Chiropractic. Today I want to go over shoulder impingement syndrome. I got my little friend here, a little skeleton. So shoulder impingement is one thing that we commonly see in our clinic. Patients working on computers, working on desks, driving, throwing motions can start causing some shoulder impingement. And what should happen is we should have this space right here. And as we go to lift overhead, basically the rotator cuff muscles should basically bring that bone down right here, and then we should be able to have enough room to clear this overhead motion and be able to lift over our head. But what happens is if these muscles have been overused, if they've been injured, instead of being able to have those rotator cuffs active and pulling that down, this gets jammed up in this joint right here, and we start kind of knocking on, we call this the bone in the shoulder, the AC joint. So what happens is patients get to a certain point, it might be 60 degrees, it might be 90 degrees, it might be 120 degrees, but patients just are not able to go overhead. So part of the treatment is clearing that joint and getting more space in this area right here. Sometimes we have to work on the scapula, but basically to get those rotator cuff muscles active and get enough room to be able to actually go overhead in the first place, which causes shoulder impingement, and that tendon in there impinges. All right, I'm going to go over next week some exercises that you can actually do to help increase the space in there and decrease some of that shoulder pain with shoulder impingement.